Lawsuits are mounting against a now closed cosmetic surgery practice in Ames, and patients are detailing their experience with Dr. Lindsey Sturm. WHO 13's Lindsay Burrell spoke with two former patients who spent thousands of dollars to repair the work that was done.
They turned to Dr. Lindsey Sturm for common reasons. Christine Heinz for a mommy makeover, Diana Dickinson to treat painful scar tissue. Both say their care fell far short of expectations. We want to warn you, this story focuses on surgical procedures, and viewers may find some images disturbing. It was a procedure that was supposed to help Christine Heinz regain her confidence.
I just had some issues that I wanted to address with myself personally that had bothered me since the earliest age I can remember.
But instead, it led to a long and expensive journey to restore her life and health.
You have a lot of hope and faith. You just have faith that they're telling you the right things to do. And when you realize that it's not right, it's a tailspin.
Right after her surgery, Heinz said that she and her husband knew something wasn't right with one of her breasts.
But he noticed right away that I had a lot of discoloration in my right nipple area. It was gray and did not look healthy. The left one was pink, looked okay. We asked about it. We were told that was normal. It was all okay.
Heinz said that discoloration ended up being dead tissue, saying weeks into her recovery, she was restitched multiple times by Dr. Sturm, leading Heinz to seek a second opinion in Omaha.
And then when I did finally switch doctors, the first thing he tells me is, you know that it's all dead, right? That it looked like something that was done in a third world country. So that was a bit of a gut punch.
Multiple surgeries to reconstruct her breast followed, but certain tissue couldn't be saved.
I don't have a right nipple. It's still very odd when you're getting dressed to see yourself in the mirror, considering what I had naturally.
During this time, Heinz said Dr. Sturm stopped returning her calls, leading her to file a complaint with the Iowa Board of Medicine. Heinz spent $35,000 in cosmetic surgery, with $13,000 of it going towards repairing Dr. Sturm's work. 3 years after her recovery, Heinz turned to Facebook, detailing her own experience.
And I thought, it's time. I didn't know there were this many, but the ones that I did know of, there were too many.
Her post was the opening other patients needed, leading to a Facebook group with thousands of members, many with similar stories.
So many of them thought they were alone. They thought they were the one-off, the unique, the outlier. There's so many that don't have any idea, like when she closed, had no idea what to do.
It was just complete and utter shock. I was less than 2 weeks out from surgery. I hadn't even had the doctor herself look at my incision yet to make sure everything was going okay.
The clinic closed weeks after Diana Dickinson had undergone $13,000 worth of cosmetic surgery, having post-surgical drainage tubes removed just days before the closure, leaving her post-op with no aftercare. It was then that she stumbled upon Heinz's Facebook group.
It is shocking to see the photos on that page and to see how many bad results are out there. I just feel for the people who maybe had their surgery that same week that she closed and still had their tubes in. What did they do? Who did they find to go take tubes out? They probably were scrambling. I just feel for those people.
Dickinson says the money she spent covered not only her surgery, but all follow-up appointments and laser treatments to help with her scars, appointments she didn't receive. After a month of no follow-up care, Dickinson paid out of pocket to seek a second opinion, with a local plastic surgeon saying her procedure is healing correctly. Now the goal is to spread awareness and help future patients find surgeons who create positive outcomes.
What if I'd have turned out like that, like some of those photos, and made it worse just because I wanted to actually live normal and ended up worse? That just would have been awful.
I don't feel like she should touch another human being for the rest of her life. My concern is that if the medical board does not take action, she can go somewhere else and do it again.
The Iowa Board of Medicine charged Dr. Sturm with professional incompetence, resulting in her voluntarily surrendering her license, which she can reapply for in 2 years. She also faces multiple lawsuits from former patients and a former employee. I reached out to Dr. Sturm repeatedly for comment over the past 4 months. She did not return any emails.
And look for more on this story coming up Monday at 10. Lindsay tells us what patients should look out for when considering cosmetic surgery.